We're delighted to say today we've got Jalak joining us, who is a dietitian with a specialist in diabetes. Hi, Jalak.
Oh, hello.
How are you?
I'm fine, thank you.
Good. Do you want to tell us a little bit about what your job role is and how you help a lot of the patients?
So I work as a diabetes specialist dietitian with GP surgery and in community. So one of the main part of my role is to working towards prevention side of thing. So before people, like in the past, we used to say that once you have a diabetes, you take lots of medication, eventually you might go on insulin. But now we focus more on working on a lifestyle changes, so people don't always need to rely on a medication, or on some cases they can even reverse your diabetes, or they can put the diabetes into remission.
Well, that's really good stuff. I know we've been referring more and more people to the dietitians because we are trying to take a more holistic and all-round approach towards diabetes. Question I had for you was what made you want to become a dietitian and then eventually with a specialist in specialist in diabetes, sorry.
I always wanted to focus more on a prevention side of things, and one of the main role for of dietitian is they work towards the prevention, whether it's diabetes or whether it could be nutrition support or weight loss, but they work more on a prevention side. I have a strong family history of diabetes, and that's where I thought that maybe focusing more on a diabetes is quite good. So I can support some more people who probably don't have information. That's why they're not focusing on their diabetes. So that's where I chose diabetes.
Yeah, okay. And I bet the patients or the people you see must have so many questions for you.
Yes, they do. It's like because people see or read so many things nowadays online, and they get confused what's right information, what's wrong, and they do come up with their own research or homework as well, that what's good or not.
Yeah. And what is the importance of a good diet in diabetes, or for preventing diabetes, or for putting diabetes in remission?
So it's quite vital. So if we focus on our diet, we can most likely delay the diabetes, or as we say, like we can reverse it as well. So sometimes people say, oh, but I have a strong family history, I have a genetics, that's why I'm getting diabetes. But it's one of the factors. But if we still focus on our diet, lifestyle, exercise, our weight, we can most likely prevent it, or even we can manage it better once we have diabetes.
Okay. I had a patient who came to see me, I think it was last week, and asked me a question, which I'm going to ask you. He said, Doc, I've been, having smoothies every morning. And I asked him, what do you put in your smoothies? Oh, I put 2 bananas, half an avocado, lots of berries, grapes, but his HbA1c was worsening. HbA1c, his sugar levels over time were worsening. What would you say to that?
Yes, so it's one of the things I get quite a lot of questions as well about the smoothies. People see lots of smoothies nowadays in the supermarket as well, that it's marketed as a very healthy drinks. So smoothies might be healthier for some people, but definitely not for people with diabetes, especially the smoothies made up of fruits. So here we can see a couple of bananas, easily 80 grams of sugar there, if it's a quite big banana. Then adding berries, so obviously it's going to affect their sugar level. But if they really like their smoothies, I would go more towards the protein-based smoothies, vegetable-based smoothies, so they can still enjoy the breakfast as they were having, but just changing the recipe.
So a take-home tip would be for, or I'm assuming what you say to a lot of the patients is, if you enjoy smoothies, carry on having your smoothies, but let's try and avoid the high sugary fruits and instead put in more green vegetables and concentrate on higher protein-based foods.
Definitely.
Is that right?
Yes, that's a very good idea.
And what kind, again, another question I get asked a lot, and what kind of fruits would you encourage? As we know, fruits have great properties, antioxidants, and just for your general overall physical and mental health. What kind of fruits would you encourage for people with diabetes, and what kind of fruits would you recommend to maybe stay away from or eat less?
So ideally, fruits which are lower in sugar is something like berries, kiwi, satsumas, tomatoes, avocados. Those are very good option. But fruits which are higher in sugar, which we generally say have it as an occasional treat or have it in a smaller portion because of its high content of sugar, is fruits like bananas or grapes, especially the dried fruits, which are quite high in sugar. So we generally say if it's not your most favorite fruit, try to avoid. If you really enjoy them, have it in a smaller quantity as a treat.
Yeah. So instead of, dried fruits as a snack, maybe what I often say is just a small handful of nuts or something.
Definitely. Yes, very good idea. So nuts, dark chocolate, those are good healthy snacks option.
Yeah. And what about food for aimed at diabetic people? I'm seeing lots of that, and it's again a question I get asked a lot. So what do you say to that?
So I often being asked, like in terms of the diabetic biscuits or a jam, diabetic cake or sugar-free biscuits, sort of food marketed as a diabetic food, which are generally tend to have a higher amount of carbohydrate, and that still affects our sugar level or our blood glucose level in the same way if we're having the amount of sugar. So those are not healthy options. It's more of a marketing thing.
Okay.
Instead of that, if they really like some food, have the normal one, but in a smaller quantity and keep it as a treat.
Okay. So the general advice is to stay away from foods that are marketed at people with diabetes.
Yes, and the other thing it affects psychologically is we think, it's a diabetic friendly food, and we tend to have them in a bigger quantity as well. So that's not gonna help us.
And what is the common advice you give to people? This is your job day in, day out. So what is sort of the top tips that you normally give to your
So I would generally say that don't feel like, I have a diabetes, I can't eat this or I can't eat that. And then most likely if you say someone that, don't do this, they definitely want to do it. Like we want to do against what we've been told to do. So I would rather say focus on your portions. If you really feel like having any particular food, focus on your portion. If you have it in a smaller quantity, that's completely fine. Rather than thinking, I can't touch it at all. The other thing I would say, focus on a protein, because when you're having a good amount of protein with each of your main meals, it keeps us full for a longer time, and it helps us to reduce the carbohydrate intake as well. And the other thing would be the processed food. It's not because we have a diabetes, but it's not good for anyone. So try to minimize the processed food as much as possible.
And how do we keep people motivated? Sometimes if you have one bad day or you've had a stressful situation and someone's had let's say a bar of chocolate after a stressful situation, and then they feel they've gone back to square one. How do we try to overcome that and just encourage to continue?
I sometimes use this as a tips that it happens with all of us. Even though I'm a dietitian, I cannot say I'm eating healthy 100% of the time. We all have some of the favorite food which might be a bit junk or processed. But as long as it doesn't become the regular habit, it's completely fine. And just start again. If you had one day of a chocolate, that's completely fine. Sometimes I give them an example of HbA1c, that if you eat junk food one day or maybe few times in 3 months, it's not going to affect your HbA1c significantly. If it becomes the pattern, that's where it's affecting your diabetes more as well.
Okay. And I know this is a really broad question, but if you had to pick, just a handful of top foods to eat in diabetes or to try and avoid diabetes or put diabetes in remission, what kind of foods would they be? I know you mentioned protein keeps you fuller for longer, but are there any, again, a common question would be superfoods or anything like that?
There's no food as a superfood, but what I would say is, again, focusing on wide nutrients as well. So like a protein, keeping your meals based at protein-based food, having more vegetables, limiting sugary drinks or processed food. So that would be a basic concept, and then they can base the meals around those tips.
Okay. And what are the people always ask me, sugar's bad, I'm avoiding sugar at all costs. but they're still eating. And when I asked them, why, you know, and I see the HbA1c going up, and they said, yeah, we eat 3 big plates of rice a day. So,
Yes.
so how do you overcome that?
Yes, so it's one of the things, again, I found it very useful to compare it with the sugar cubes because people think that, it doesn't taste sweet, which means I can have a full plate of rice or I can have a 4 or 5 bread in one meal, which is quite a big portion. But when you compare it with all the carbohydrate is still going to affect your blood glucose level. And if you compare it with the teaspoons of sugar, so for example, plate of rice is about 100 grams of sugar, which is 20 teaspoons of sugar. And I quite often ask the question that, if I give you 20 teaspoons of sugar in a jug of water, would you drink it in a one go? And they say, no, that's silly. Are you crazy? So it's the same thing. We're doing a plate of rice in a one meal. So that's a similar example.
Yeah. So it's quite, especially in the area where we get people asking us, people are commonly eating a big plate of rice at least twice a day.
Yes.
So that's 40 to 60 spoons of sugar, essentially.
Yes, and then that's quite a lot. And then they say, I'm not eating sugar, but this is also the same thing. They're having lots of sugar, but just in a different form. But it's more about understanding that sugar comes from lots of different food, even though if it doesn't taste sweet.
Okay. All right. And another question that we commonly get asked is about fats. Do we eat fats? Do we not eat fats? What?
Yes, so fat is, again, historically, we always been like a bit scared about eating fat, isn't it? If I eat fat, it's going to make me fat, so I can't eat fat, isn't it? But when you're reducing carbohydrate, your body still needs some fuel. And the fuel that we get from protein and healthy fats. So the important fact here is what kind of fat we're eating. We're definitely not talking about processed meat or like a fried fish or chips. So not those sort of food, but fat from the healthy food. So it could be something like avocado, nuts, fish, eggs, milk and yogurt with the full fat. And it's completely fine if we have it in a moderation. The other thing I always focus is, if you're reducing your carbohydrate, then increase your fat a little bit extra, but don't overdo on a fat. Like sometimes people say, I'm having a big packet of nuts in a one go. Because you told me it's healthy, then it's not going to help them in terms of if they're trying to lose weight at the same time.
And I suppose that comes back to what you said earlier about portion control.
Definitely, and choosing the healthy food, and that's completely fine.
Yeah, okay, all right. And any general tips that you give to your patients that you see? I know we've covered a fair bit already today, but are there any sort of take-home tips that you often will give, or is it?
As I say, we covered lots of those things, so don't want to repeat those, but I would generally say that think before you eat, because it's very easy that sometimes we eat due to boredom or stress or because of the social reasons. So think before you eat if you're really hungry or not. Sometimes having a glass of water really helps us to cutting down on snacks. If you're not hungry, 2 to 3 meals are more than enough for most of us. We don't need to eat 5-6 meals a day. When we keep eating, that also affects our diabetes, our weight, our blood glucose levels. Staying active is a good way. So alongside making some dietary changes, do some exercise and focus on a total carbohydrate rather than just focusing on sugar. And some healthy sugar, we think like a fruit or fruit juice may not be that healthy if we excessively having those. So be mindful of those natural sugar as well.
Yeah. So fruit juices are very high in sugar, aren't
Definitely.
It's a conversation we have daily.
Yes, and I hear it quite often. People say, I'm having a liter of fruit juice every day, even though if they have a diabetes, but they think it's healthy. So that's definitely one of the things to think about what we're drinking as well.
And what about, Jalak, what about the diets that people go on? So often people will say, I've been doing the keto diet for the last 8 weeks and I've lost a significant amount of weight, or I've just been doing a shake, milkshake diet for the last 4 months and I've lost X amount. What's your thoughts, and how do you approach people who want to or ask you about those kind of diets?
We have some very good evidence now that even losing weight quickly can help us to put our diabetes into remission, but it may not be safe for everyone. So if someone wants some extra support for that, the good way to maybe refer them to dietitian, refer them to diabetes group education. So when they're starting it, they start with the right information rather than just following maybe some internet information or some online information. So at least they can get extra support if they need. but it might be a good idea for some people. We can't say, oh, that's definitely no, but they may need additional support, and it may not be good for everyone. So for example, if someone is on insulin, and if they suddenly think that, oh, one of my colleague or friends started on intermittent fasting or 800 calorie diet and I'll follow them, that's not a good way for them because of the medication or insulin they're taking. So it's always a good idea to speak with healthcare professional if they want to make a significant dietary changes.
That's great. A question that we've just had is, in a very broad way, is what kind of patients do you see?
So as a dietitian, I see, even though my personal interest is more towards diabetes, but I see lots of patients as well. So it could be someone for just a simple thing like a weight management. They tried few things, but it's not helping them. So they just want to identify where they need to improve. Sometimes it could be related to some gastro issues like IBS, bloating, diarrhea, abdominal pain, food intolerances. Sometimes it could be the opposite side of things. So people losing some weight, they can't eat and they need some help in terms of how to increase their nutritional intake. It could be to control their cholesterol level. It could be to discuss about like maybe over like how to prevent further heart disease if they have a strong family history. So as a dietitian, we see quite a variety of patients. Depends on what's their concerns.
I think the role of the dietitian is growing because I find we're making more referrals to yourselves because people now, what I think, people now actually want nutritional support and help and find it really useful.
Definitely. So in the past, we were like, oh, just prescribe me some medication. So I want some easy pill. But now people are like, oh, I don't want to take medication. Can you provide me some support where I can work on my lifestyle? So I don't need to take statins. I don't need to take medication. So there is definitely more awareness towards making lifestyle changes.
Okay, that's great. Thank you. So...
Awesome, of course.
So a question that we've just been asked is, I think especially in the area where our practice is, we've got a large population of people from South Asia, India, Pakistan, Bangladesh. What is the South Asian diet like in relation to diabetes? That's a very big question, but I think it's a very important and crucial question.
Yes, and one of the funniest thing I would like to share is like sometimes when some of the Asian patients or like when they get new diagnosis of diabetes, they see their GP and they're like, you're eating too many chapatis, you need to cut down, and they stop having chapati. Like very good patients, they follow everything the doctor says, but then they start having bread, and it's the same thing as well. So one of the other problem with the Asian diet is they may not be eating lots of processed food or junk food. They try to make the food from the scratch and they feel like, oh, we're eating healthy, but it's also what involves in our food. So if we're eating lots of chapati, potato, rice, bread, those are quite high in carbohydrate, and that also affects our blood glucose level in the same way as if we're having lots of sugar or lots of biscuits or chocolates. So it's as we were discussing before, it's more about the portions as well. So even though it doesn't taste sweet, but portions do matter. So for example, sometimes people say, I'm having 2 chapatis, but chapati size could be vary quite significantly. Ideally, it should be something that fits in your palm. You can still see the tip of your finger. So quite tiny chapati, and 1 or 2 of those is more than enough.
So you just answered my next question there was going to be, how big should a chapati actually be? Because when I ask people this, it's definitely probably double or triple the size of what you're saying, and they will eat 2 or 3 of them.
Yes, so even if it's like a quite tiny, would be still 15 grams of sugar. If you're eating those big chapati, thick chapati, could be up to 60, 70 grams of sugar per chapati. And we don't always have just 1 a day. We have 2 for breakfast, 2 for lunch, and 2 for dinner. So
it's
imagine.
just like that rice thing.
Same with the rice thing, isn't it?
Yeah.
So it's more about our portions as well. And what we're having with that. So I quite often get the answer there, with my chapati, I'm having potato curry. What we're going to get from those foods? So it's a chapati and potato is not a good combination. If you're eating for breakfast, porridge and banana, not a good combination because all we're having is just having sugar with sugar.
Porridge and banana is not a good combination.
Not a good combination because what we're doing is 30-40 grams of carbohydrate from porridge. We're adding on top of that another 30-40 grams of sugar from banana.
Okay. And what about oils in cooking? I get asked this all the time as well.
So ideally, something like an extra virgin olive oil or cold pressed rapeseed oil is a good cooking oil.
Yeah.
Some of the oil, like a vegetable oil, is highly processed oil, so we try to stay away from that. Especially in the Asian diet, we use quite a lot of ghee, and we think, oh, ghee is not that harmful, but again, it's the portion. It's quite high in a saturated fat.
Okay.
So it's okay to use like a teaspoon of ghee on a chapati, or if something special we are making, but most of our cooking oil should be extra virgin olive oil, not the ghee or butter.
Okay, all right, thank you. Thanks. Any more questions? Yeah. Yes. So Jalak, what's the importance of having a balanced diet?
So it's more about our overall well-being as well. So it's sometimes people think, oh, I don't need to eat healthy because I don't need to lose weight, or I have a good weight, I don't have a diabetes, I can eat anything that I want. But it's more of preventing further problems or for overall well-being. It's quite important that we think about what we're eating. And balanced diet means something where we're having a good amount of vegetables, couple of portions of fruits, protein-based food with each of our meals, and small portion of carbohydrate-based food.
Okay. And for those that have a goal in mind, how do you normally advise to track progress?
So it's completely up to individuals. I see quite a few people who thinks, oh, if I have like a stricter target, I work better. So for example, say if I say, oh, try to gradually lose weight, and they were like, oh, if I see 10 kilos weight loss in 1 year, I probably won't bother. While other people would be that, if I do it gradually, it's more sustainable for me. So it's whatever works for them. Or while other people would be like, if I keep any goals, they would be very stressful. And if I don't meet the target, then it affects my mental health. So then keeping a target is not a right thing for them.
Okay. And what about the importance of planning ahead? So preparing your meals, if people are living busy lives, the importance of meal planning.
That's very important, a very good question as well, because as you say, sometimes we have a very busy life if we don't have a plan, and then we end up like, oh, I'm starving now, and at that point you're not going to think about like, let's cook something very healthy from the scratch, and you end up having anything that's available. Could be even a packet of crisps or biscuits or chocolate, any rubbish available, or maybe quick meal like a frozen meal, or you just want to put in the oven and microwave. So, but if you have a plan, if you have planned your meals in advance, then you have all the ingredients ready. You can do some preparation when you are free. You might have a ready meal, or like a meal that you already prepared in advance, like a day before.
Yeah.
So it's definitely useful in terms of eating healthy.
Yeah. Okay. All right. And eating late. That's another common thing that I suppose we get asked. Should we be eating late? Can we eat late?
Ideally not. So for a few reasons. So for example, if I'm having my dinner at 11 o'clock at night and then going to bed at midnight, my body doesn't get enough time to digest the food. So common problem that we hear is acid reflux sort of problem, or they have a lot of gastro issues which could be related to their meal timing. And same with the diabetes side of things as well. If they have a longer fasting time, it helps them to keep their blood glucose level under control as well.
Thank you very much. Thank you. So Jalak, historically, I remember when I was younger, we always used to get told breakfast is the most important meal of the day, and you should have a big breakfast, and it gives you fuel for the rest of the day. And now, upon small bits of research and reading I've done, a lot of people are saying actually no. A lot of people are skipping breakfast or not eating breakfast or just having a black coffee. What are your views on that, and what do you think is the healthiest approach, if any?
I would say listen to your body. So I'm a kind of opposite person. I don't feel hungry in the morning, but I eat more towards the lunch and evening meal, while other people think, if I eat a good breakfast, it keeps me full for a longer time during the day. It helps me to cut down on my snacking, and that's perfectly fine as well. So I would say whatever works for you. Yeah. But if you're noticing that I'm skipping breakfast, but then I'm having, say, 5 biscuits with my tea around 11 o'clock because I'm starving, then that's not a right approach for you. Then try to add something healthy for breakfast so you can avoid those extra snacks.
So the key thing is understanding how your body works, and if you are going to eat breakfast, it's the quality of the foods that you and ingredients and nutrients that you're putting in.
Definitely,
Right?
but don't think that, oh, I need to eat breakfast, which means I can eat any rubbish.
Okay.
So like, for example, having a big bowl of cornflakes with milk for breakfast for the sake of having, it's not a good option.
So it's about understanding how your body works, isn't it?
Yes, and choosing a healthy option as you
Yeah.
suggested.
Yeah. Okay, great, thanks. So Jalak, in terms of, we live busy lives like we discussed, and a lot of us have big family gatherings, social events, meeting up with friends, going out for dinner is, a common thing that's done. And often a thing is people will speak about is peer pressure, just have one more of this, or, it's not going to hurt to have a dessert. You can skip doing any exercise today and let's just go and do this. How do we try and overcome that?
So one of the things I would suggest is the willpower. So it's difficult, especially with some extra social pressure. We don't want to say no. We feel bad, especially if you've never done it before. But if you say once or twice, like politely, no for something, people will know. They will probably won't, like, force you next time, because they would probably think, oh, they won't eat it. So for example, if I give you example, in my family, that they generally ask my family members, so have one or have a little bit extra, it's fine. They would hardly ask me, because they were like, oh, she won't touch it. So it's once you have the image, it's then much more easier. They would probably support you in your decision, but it's probably initial once or twice might be a bit difficult.
Creating discipline.
Yes.
Okay. So a colleague of mine recently shared a story with me, and he was telling me about, that his children kept stealing food from the kitchen, and typically food that we all find quite tasty but may not necessarily be the best or healthiest food. They've even tried locking away the food, and unfortunately I don't think it worked. So I think that from the New Year's they decided that they're just going to completely ban all junk food entering the house. What are your views on that? Do you think that's a good thing, a bad thing?
Yeah, sounds like a very good plan. So if you keep all those food, if it's handy, it's quite tempting. Once you open the packet, sometimes we feel like, oh, it's addictive as well. But if it's not there, most likely, if you craving for some food, we're quite lazy generation nowadays. So we're not gonna get up and buy the food from the supermarket. So it's easy to control when it's not there. So it's a good idea not to buy those food, as it's not good for anyone.
Okay. I'll tell him to show this to his kids. So in a short while, we'll be going to Asda next door with our patients, and we're going to do a tour of the supermarket and ask them to pick out some foods that they think are healthy and unhealthy. Any top tips for going to the supermarket?
So a few things I would suggest is, definitely from my personal experience, don't go for food shopping when you're hungry. I used to do that and then end up buying lots of junk unnecessary. Once it's at home and you can't resist, so go it after your meal, and it's much more easy to resist. Other thing is go with your shopping list, so it might help you to avoid like unnecessary just roaming around then buying because it's on offer. Let's get extra packet of crisp, or let's get this chocolate because it's so cheap, I can't avoid it, or it's reduced to clear set of options. So those tips might help if you have a list, or maybe avoid those aisles completely where you know that it might be a bit tempting and I won't be able to resist. So avoid the tills where you generally find like a crisps or biscuits or offers. Then it might help us to just completely stay away from that.
Yeah. Okay, that's great. Thank you. Great.
Thank you.
Well, thank you so much for joining us today. I've learnt a lot, so hopefully, everyone watching will appreciate it just as much as I have. So thank you very much.
Thank you so much.
Thanks a lot.
Thanks.
That's brilliant. You're both pros, aren't they?